Hello everyone, my name is Cassandra Folkins and I completed this study as part of my Masters of Applied Health Services Research at the University of New Brunswick in Fredericton, New Brunswick, Canada. My team consisted of Jeff Mundee, Emily Reed and Scott Bateman, also from UNB, and Max Birk from Eindhoven University of Technology in the Netherlands. This study was carried out in partnership with the New Brunswick Association of Nursing Homes, which represents all licensed nursing homes in the province of New Brunswick in Canada. Today I'm going to tell you how we developed and used a serious game called Journey Through Carington House to positively impact the perception youth have towards nursing homes. This is in response to an increasing workforce shortage in the nursing home sector. The Nursing Home Association and its members were seeking a way to attract new candidates to a career in nursing homes. The major problems that our game sets out to address are ageism and the media's consistent negative portrayal of nursing homes that is so pervasive that it often affects career path decision making, even among young people. The province of New Brunswick in Canada is experiencing rapid population aging. It is one of the oldest provinces in the country with almost 20% of the population over the age of 65. So the care needs for older adults are becoming inverse to the labor supply. We do not have enough working age adults to take on the caregiving role. The province's demographics create a challenge regardless of the industry. However, the negative image associated with nursing homes makes it even harder to attract people to a career in the field. So anecdotally, we know that nursing homes have a bad reputation and they're seen as places that no one wants to live or work. And research demonstrates this attitude in the general public, as well as in professionals and students who work in healthcare, such as nurses. They do not want to work in nursing homes. This image problem is also perpetuated in the media with a lot of negative coverage of nursing homes, and there's a lot of misinformation as well. So people really don't know what it is to be living in a nursing home or to be working in a nursing home, and this really hinders our ability to recruit qualified candidates. The industry was looking for a way to engage youth and get them interested in a career in nursing homes. We knew the image of nursing homes was a barrier to attracting people to a career in the field. And we also knew that children hold these negative views, and these are formed long before they even begin to consider a career path. But we also knew that it was possible to positively influence children's attitudes towards aging and care homes through various interventions, like intergenerational experiences, for instance, which are particularly effective. What we wanted to explore was whether we could influence their attitudes through a video game, an intervention that would be highly accessible to youth, particularly in the absence of an opportunity for face-to-face interpersonal experience with seniors or in actual nursing homes. Carington House is a point-and-click adventure-style game in the tradition of games like The Curse of Monkey Island. We chose this style to allow players to assist residents in activities of daily living that were drawn from stories of nursing home staff. The types of activities, for example, helping a character find a misplaced hearing aid, naturally aligned with the puzzles and adventure games and allowed the player to engage with our carefully designed dialogue. The imagery and the stories are drawn from real-world experiences. However, they focus on the positive imagery and outcomes in the game to help counteract those strong negative bias that already exist. So our dialogue kept the tone light by using campy humor that the adventure game genre is known for. And you can play Carington House right now at nursinghomeJobsNB.ca. For our study design, we used focus groups with youth aged 10 to 16 years. We had 22 participants broken up into 3 groups. Focus groups were really the right choice here as they allow for that in-depth exploration of a topic, some rich discussion coming from that group dynamic. And they're also really great for making kids feel comfortable in discussion. So they're among their peers and they encourage each other along. And we closely followed Kruger's methods for designing focus groups and focus group questions. And we also had participants complete a demographic survey. The results of the study are represented by 2 overarching themes that emerged from the focus group data. The first theme, perceptions of nursing homes, had several sub-themes. We found that the negative stereotypes about older adults in nursing homes that we know to be present in the general public were indeed part of these participants' own thoughts. They talked about nursing homes as being, quote, prisons for oldies, and they associated them with death. But we also found that after playing the game, the kids started asking questions about nursing homes and connecting the game to their real-life experiences with grandparents, their communities, into nursing homes they had visited or heard about before. They also got the impression that nursing homes were busy places to work and could be challenging and more dynamic places than they originally thought, and that in a nursing home you could find interesting people. And our participants also said that the game made them feel really good about nursing homes, and they would even consider it as a career option. We had one participant say they wanted to become a nurse. And during our focus groups, we also had lots of conversations about the game experience itself, the gameplay, the characters, the plot. They enjoyed the graphics and the characters, and of course they had lots of suggestions on how to make the game even better. Our findings indicate that indeed we can have an impact on youth attitudes towards nursing homes using a game. The use of the point-and-click adventure genre allowed players to connect with the characters through the narrative. So our interactive dialogue reflects the real-life dynamic of that caregiving role and the relationship building that needs to happen to provide quality care, especially to seniors in a nursing home. We were also able to successfully use humor in the game to engage the audience and help them connect with the characters in the story. For this reason, we believe that this style of game could be a really effective medium for counteracting negative biases, and we would like to explore this in our future work. And this research was supported by MyTax, NSERC, and the New Brunswick Association of Nursing Homes. Thank you.